Wrap up, if you can be brief and with your comments. And
I'm Jeff.
It's been a good little discussion today, folks. I really enjoy it.
I'm Jeff Stier. I'm a senior fellow at the National Center for Public Policy Research, and I appreciate the seat on the table together with industry, but I'm not industry. I represent consumers and a free market approach, so I can be quick today because I think you all get it. You understand how markets work and how that markets are better at solving problems than the government is. And when you look at public health, and I represent public health, these people sitting next to me are the true public health heroes because they are helping people happily quit smoking, something that the government has been unable to do. With all the taxes, all the regulation, all the warning labels, they haven't accomplished what my colleagues here have been able to accomplish, happily quitting smoking and dramatically reducing their risk. And when you think about public health, they're not taking a taxpayer penny. They're actually giving back to the community, and they're voluntarily, in their own interest, helping people quit smoking. And I think that's what's so fantastic about it. I've testified about this issue from the United Nations down to the FDA, the White House at Office of Management and Budget, state capitals around the country, and local governments. And I'm so happy to be here before your committee because your committee, your law, has gotten it right more than almost any other state has. So it's a pleasure for me to be, while you're still here, Chairman, to be before your committee. It means a lot to me, and I know that you get it. I wanted to make, however, a couple points, perhaps nuances that you might want to consider as you look at this. And it's not actually coming from me, but it's actually coming from Mitch Zeller, the head of the FDA's tobacco division, where he talked about, yes, the importance, I think everyone's on the same page, about keeping these products out of the hands of kids. We're all on the same page. Making sure that industry doesn't accidentally poison anybody. We're all on the same page. A third element to appropriate regulation of these products, as Mitch Zeller has explained, is the idea, the concept of tobacco harm reduction. And I appreciate the libertarian bent. I share it. But from a public health perspective, Public Health England has said these products are at least 95% less harmful than smoking. The Royal College of Physicians in England has just come out and recommended that doctors advocate that their patients, recommend that their patients use these products instead of smoking because they're so much less harmful. So what Mitch Zeller from the FDA has been saying, in addition to these regulations, is that not only should we make sure that the regulations are fair and allow these products on the market, but to thread the needle with the regulation to make sure that while we don't let kids get their hands on these products and don't poison anybody, we also don't limit access to adult smokers. And I was concerned with all the good things that I heard from the Department of Public Health here, the talk about flavors. Flavors are critical in e-cigarettes to make sure that adult smokers who quit stay off of cigarettes because adults find those sweet flavors so appealing that they quit smoking and they use these products instead. And if anyone did anything against flavors, people would go back to smoking because adult smokers, adult former smokers, love flavors so much that it got them to quit smoking. They learned that they actually don't like the flavor of burned tobacco. They actually like the sweet flavors, and that keeps them off of smoking. So flavors are critical. And with regard to some of the numbers we've seen that the health department presented on vapor use by young people, I just want to caution that while everyone agrees that youth shouldn't use these products, the chart that was available, it was on page 3, showed a very steep increase in youth vapor use. There should be no use of vapor use, but it also coincided, very interestingly, with a recent decline in youth smoking rates. I wonder why that is. And while there should be no use of any vapor products by any youth whatsoever, that sharp increase, did you ever read the book, How to Lie with Statistics? It used a graph like this, where it zooms in on some number to make it look huge. And there's no excuse there shouldn't be any. But this graphic is an example like that was in that book because it shows an increase in a short period of time. And actually the backdrop is a decrease in smoking rates, and you can reach your own decisions about why that is. But I just want to congratulate this committee and the state for an excellent job. I've seen it play out in different states around the country, in the federal government as well as internationally. And I think you guys have done what Mitch Zeller from the FDA has asked for, is to get that appropriate balance between making sure kids don't use their product and no one gets poisoned, but also protecting the idea of tobacco harm reduction for adult smokers to quit. Because not only should they have a choice, but it's something that I think regulations should be set up to encourage people to quit smoking. That's good for public health, especially if they do so voluntarily, which is why I appreciate your approach on taxation, that if you're going to tax these products, if you're going to have a sin tax, and I don't like the idea of sin taxes either, but if you're going to have a sin tax, then the rate of the tax ought to be in line with the degree of the sin. And e-cigarettes are a dramatically less bad sin than smoking. So we have to keep that in mind. And with regard to the FDA, to the Cole-Bishop Amendment, this federal rule, I agree with you. If we're going to ingest these products, we ought to test them. I think everybody agrees to that. But what the FDA actual regulation does is it sets such a high standard at $1 million per SKU number, per each and every product. So if you have 60, that's going to put Mark out of business because it's $60 million, not just $1 million. And there is a way to test these products, and I'm an advocate for the free market that should be appropriately regulated. The deeming regulation, which goes back to this 2007 grandfather date. Imagine this. Imagine an iPhone, which came out around the same time. Could you imagine and I think those products should be tested, right? We have to make sure that iPhones are safe. Could you imagine if the federal government the FCC came out with a rule that said all iPhones today have to be the same as the first generation? That would drive people crazy. You can only use the first generation iPhone, or each new app on your iPhone has to go through $1 million testing. That's absurd. And iPhones don't save the lives of people the way e-cigarettes do. So the FDA rule, as is in place now, and by the way, they can ban flavors. They have the deeming regulations are what Mitch Seller describes as a framework, an architecture for future regulation, depending on how the science comes in. So they can do that. But what they're doing now, by going back to 2007, it is going to put the small businesses out of business and is going to raise the cost. It's going to be basically a regulatory tax on smokers who want to switch because it's going to raise the cost of the product so much. There's got to be a better way to do it, and the one way to do it is the Cole-Bishop Amendment, at least for now, stops the death knell of innovation. Right now, innovation is over. No one's investing in this industry anymore for innovation to make these products safer, less appealing to children, and yes, more attractive to adult smokers. Nobody's innovating because innovation ends on August 8th or already. So thank you again for having me. I'm happy to answer any questions if there are any, but I'm so happy to see that you all seem to get it.
We need to move along. We have some other issues that we need to cover today. So I want to thank you for your testimony. Do you have a pressing